Dr. Yeakel, are you there with us? Oh, there you are on the screen.
Yes, sir, I am.
Well, we appreciate you being here, and if you've been with us since we started earlier today, I'm exceptionally grateful for you for staying around this long. As you've seen and heard, what we've done with the others is, before the Oversight Committee, you do have to be sworn in under oath. So if I may, if you would please state your full name for the record, tell us where you're from, and raise your right hand.
My name is Christopher Yeakel. I'm a physician and a member of the South Carolina Medical Association, and I'm here in Columbia.
Thank you, sir. If you'll raise your right hand, do you solemnly swear all testimony you give will be the truth, the whole truth, and nothing but the truth?
Yes, sir.
Thank you very much. We appreciate you being here. Members may have questions for you, but at the outset, we'd like to hear from you with regard to the topic we've been talking about today, which is the effectiveness or challenges that currently exist with the COVID vaccination process in South Carolina.
Well, again, good afternoon, Mr. Chairman and committee members, and I want to thank you for this opportunity to offer comments. And I know that you've had a long day already, so I will keep my comments as brief as possible. And this pandemic has created enormous pain, suffering, and cost to all of humanity, and physicians, along with many other professionals of all disciplines worldwide, have searched for the best paths forward. And with the arrival of vaccines for this virus, there is great hope. But as you're well aware, in this fog of viral warfare, the vaccine rollout has not been perfect. So I have four very brief statements to offer, and then I'll offer a little detail about them. But number one, physicians have wanted to and continue to want to receive the COVID-19 vaccine, but many could not sign up until the week of January 4th. Number two, physicians want to vaccinate their patients. Number three, patients do not understand why we cannot vaccinate them. And then vaccination by local physician works. And to elaborate just a bit on the first point, physicians wanting to receive the COVID-19 vaccine, but a delay in being able to sign up. I've been with you since the start, and I know the narrative and details surrounding this issue since mid-December have already been outlined to you, but the SCMA has been working with DHEC about the need to change its guidance to include physicians not affiliated with a hospital in the Phase 1A guidance. And again, the DHEC guidance to open up access did not equate to a mechanism for signing up for physicians and their staff until the week of January 4th. And these non-hospital affiliated or employed physicians have been seeing and treating patients with COVID-19, as the overwhelming majority of patients with COVID-19 are not admitted to hospitals. So there's been reporting that frontline physicians and their staff were not signing up, but there are reasons for that. The SCMA has received many contacts from physicians during this time, and they're distraught that they could not be vaccinated. And they were also distraught that they could not protect their medical assistants and frontline staff. So these physicians shouldn't be in the back of the line when they could not sign up, and neither should their medical staff. So bottom line, we would like you and the public to understand that physicians do want to be vaccinated, and we believe that it is safe to be vaccinated. For the second point of physicians wanting to vaccinate their patients, I think it is probably simplest and most efficient to quote Dr. John Ropp, who's a family medicine physician in Hartsville. And I quote, "Primary care is ideally situated to handle vaccinations." He says, "Send me all the vaccine you want, and we will get it into the people who need it now. If we have leftover, like we do now with other vaccines, such as the flu, we will get it to other practices in town like we always have done." And another willing setting is our free medical clinics that are ready to receive vaccine. They have eager volunteer staff, and they're ready to go. Dr. Ropp is the medical director of his county's free medical clinic, and they applied early to be a site, but as you have heard the term used by DHEC, they have yet to be activated. So physician practices such as Dr. Rops understand separating the sick from the well visits, and they often have separate waiting areas already designed for this, unlike hospitals and urgent cares that are equipped for emergencies. Hospitals are already stretched treating COVID-19 patients and other acute care patients, as we all know. So Dr. Ropp is just one of many physician practices that ask that you make it easier, if possible, and more transparent for physician practices to know when they will be activated, and that if they need more vaccine, knowing when it will be available will be helpful. Patients do not understand why we cannot vaccinate them. Just as you as legislators are hearing from your constituents, we are hearing from our patients. They want to know if or when we can offer them vaccinations. In this pandemic, they have sometimes even forgone care because of concerns with safety, but keep coming back to us. And in some cases, our patients think we have failed them, that we are unable or unwilling to help them in this crisis. We have even heard of some patients switching their care to get in with a physician that works in a hospital system so that they have a better chance of getting vaccinated. Patients don't understand cold storage necessarily, or availability, or waiting to be activated to be able to vaccinate, but they do understand that in their fear and concern, they want to do what they have done for many years, which is turn towards physicians who have cared for them in past years for information and their health care. And finally, vaccination by a local physician works. Activating sites quickly and creating paths to distribute the vaccine outside of hospitals is crucial. Our patients want this access to practices they know and trust over sometimes many years and generations of care. And as we continue to move forward and vaccinate the public, patients who may not even want the vaccine at present may also change their mind if they talk to a trusted physician whom they have seen for years. This vaccination alternative can help hospitals, which are already stretched thin, treating COVID patients, as you've heard. So bottom line, if you can somehow activate more registered practices and provide more vaccine, our independent physician practices are open, they are willing, and they are able to vaccinate patients every day. And I thank you for letting me offer these comments.
Dr. Yeakel, thank you very much. Now, I don't know if Ms. Taylor is there and would like to offer additional thoughts or comments. Either way, I'm going to start going around the room and see if there are questions by members of the body. Does Ms. Taylor want to offer her comments at this point in time, or?
She is available, but in the interest of time, and she is willing to go ahead and let you proceed.
Okay, good. Questions by members of the committee? Mr. West?
Good afternoon, Doctor. Thank you for joining us. I'm guessing when you speak about vaccinations at the GP level, you're concerned with receiving Moderna. Do many facilities that you know of at the GP level have the capability for the Sub-Zero Pfizer vaccine?
I think you're right, sir. The primary vaccine that would be useful is the Moderna one.
Okay, thank you very much.
And Dr. Yeakel, from your, and I'm sorry that this day has been a long one and that the DHEC folks aren't still here, because it would be nice to have a two-way dialogue, but as you heard me mention, we intend to send them some follow-up inquiries as well. From your perspective, now, obviously I understand that there was not the ability to sign up until January the 4th. And there was a delay in that. We're beyond that date now, but I'm guessing that there are physician practices that are signing up but still have not yet been activated. And I understand from DHEC that they don't have them to allocate. If you heard Mr. Taylor talking about the DHEC board having the meeting and looking to them to identify and approve an allocation plan for on February 1st for future first doses coming into the state. What is your understanding as on behalf of the association? I mean, what are we talking about in number of physician practices that have either tried to sign up, can't sign up, have yet to be, I mean, are all credentialed by whoever needs to say yes and bless them that just hadn't received any vaccine yet? Help fill in some of those blanks for us.
I am going to ask Rochelle for more details on that, and she can perhaps follow up with more exact details, but it's my understanding that literally hundreds of physician practices throughout the state, not affiliated with hospitals, obviously, have registered and have been accepted, but are awaiting activation. And I heard testimony and have been following the news like everyone has, that at this point, even if they were activated, the supply chain of, in this case, Moderna vaccine is simply, at this point in time, not there.
Okay.
But
So what I'm hearing from you,
willing to get started.
If we asked you, tell us what, in your opinion, for you all's role that is capable of being offered, what's needed, and I don't want to put words in your mouth, but what I'm hearing you say is the same thing that we've heard earlier, more vaccines, and in particular, more Moderna vaccines is for the state as a whole coming in. I think the number is 30 some odd thousand a week. It sounds to me like from where you all are today, I mean, it's getting more physician practices registered and accepted so that you're ready to go when it ramps up. And that's probably a follow-up point for us for DHEC. What are y'all doing to register and accept as many physician practices as possible? Because those practices ought to be included in the thought process, certainly in the rural areas where there are no hospitals, as part of that DHEC allocation plan. I mean, you all's capabilities of delivering the vaccine should be included, albeit we're just talking about the Moderna vaccine now.
Again, I agree. The only thing I would add to that is that there are a significant number of physician practices that have registered, have been accepted by the DHEC process, and are simply awaiting activation, being turned on, if you will. And you've heard the reasons why that hasn't happened from the DHEC testimony. Got it.
Okay. Other questions by members of the committee? Mr. Hickson. Oh, I'm sorry. Wait a minute. I got Mr. Ott remotely has a question. Bill, I'm sorry. He was on the list for you. Mr. Ott.
Thank you, Mr. Chairman, and thank you, Doctor, for your testimony. Thank you for your willingness and your association's willingness to step up to the plate and try to help with this problem. And I echo what Chairman Newton was saying earlier. It would certainly be helpful for DHEC to be able to be here and try to add to the conversation. But since they're not, I guess what I'm trying, I don't know that I've necessarily heard from DHEC why the physicians have not been able to be activated. I would just echo what you said. I continue to hear from constituents that continue to wonder why they can't go to their primary care doctor or their primary physician, who they trust, who has the availability of kind of streamlining the process of making an appointment so that people aren't having to wait on these calls for hours on end. The more people we get vaccinated in the more places, obviously that is lessening the strain on the system. So I guess I'm just asking you, do you have an understanding? Do you feel like you have an understanding from DHEC, or the other physicians have an understanding for DHEC why they can't be activated? I mean, I understand that it's, if we don't have the vaccines to distribute, that obviously is an issue. But if we're having, I guess what I'm trying to figure out is of the vaccines that we do have, why can't some of them be distributed to the physicians for their use with their individual patients? And do you feel like you've been given that answer from DHEC?
Well, I think the lines of communication are there and are continuing to improve between DHEC and the SCMA as well as the SCHA and all those who are responsible for the rollout. So I think that, with that improvement and further enhancement and the dialogue continuing, that again, anything that this committee can do to help speed that process of getting vaccine into the hands of physician practices that are registered, accepted, we are ready to respond. And if I could, just for a moment, you mentioned your constituents. There's a nuance to the elderly who have been included now, age 70 and up, who many times they can be encouraged to, and you've heard it, I'm sure, firsthand, that they're encouraged to sign up, go to a website, go to a phone and call a particular number. But many times they do hesitate to even register until they talk with their physician about it. So, and that added level of communication and interaction simply slows the process down of getting the vaccine to them. So again, getting it to the physician practices where these patients are known, where they know their physician, would be ideal as quickly as possible.
I agree. Thank you very much.
Thank you.
Yes, sir. I guess I would address this to you, Mr. Chairman. It sounds like we're going to be writing a letter to DHEC asking some follow-up questions or.
We are, and my concluding comments in the meeting today is if members of the ad hoc committee have questions that they would like presented to DHEC, we can get them to staff the end of the week.
Okay.
And we'll get those in a letter.
Because I was following up on their letter that they wrote about getting people that want to volunteer to sign up, and there's no way to do that.
That want to volunteer.
In other words, in the letter that come from Dr. Finch, it says additionally, independent physicians and retired physicians have asked to volunteer for the COVID-19 vaccine, but there's no mechanism for them to sign up. They want to volunteer and help, and there's no way for volunteers to sign up. Yes, sir. That's all I want to say. Thank you.
Mr. West, I understand you have a question for Dr. Yeakel, and then Mr. Wood.
Of course, Mr. Chairman, I appreciate that. Doctor, I do have just two brief questions. I was thinking about this. One of the issues that we faced earlier this morning in our discussions with DHEC and our questions was the fact that not everybody has an email, nor do they have access to text in the elderly population. But my guess is general practice physicians are seeing that population probably, along with the pharmacist, more than any other person who could vaccinate in the future. So I understand your concern, and that may be precisely a way for us to encourage DHEC to use the general practitioners when the more Moderna is available. But also not just the big chain pharmacies, but in the rural parts of the state, we have smaller pharmacies that may have 1, 2, or 3 offices, but they see those patients a lot more than anyone else will. So I think you bring forth a very valid point, and I appreciate that. I have had a question several times, and you may not be willing to answer this question. I understand for liability reasons if you are not. But there seems to be a lot of confusion for young females who are in childbearing years or pre-childbearing years about whether or not to take the vaccine. And I have been unable to ask that question, but some are waiting to see. And I have a little experience with particular vaccine delivery systems, and I know we've changed the delivery, Now we're doing mRNA, and it's not all vector vaccines or attenuated viruses and delivery systems, but can you speak to that in terms of the safety of the vaccine for our younger females who are in childbearing years, and whether or not, as a physician, you would recommend or not recommend? And as I prefaced, I understand if you don't.
Well, Representative West, I appreciate the question, and there are experts within our profession who we can have you put in touch with to give you that answer. My particular specialty is anesthesiology, and in particular pediatric anesthesiology. So my exposure to obstetrics has been to really just primarily do epidurals for pain relief. So I honestly can't speak to the safety and in that particular patient population. But again, as soon as I get off the call, I'm pretty sure Rochelle has your contact info, and we can get someone in touch with you to help you with that answer.
Thank you, Doctor. If you could get the organization even to contact staff and relay that information, we'll get it to DHEC. But that is an educational issue that we face right now with vaccinations for the female population. Thank you very much.
Well, I think Dr. Traxler also would be a resource for that as well. But again, we will follow up.
Thank you, sir. Mr. Wooten?
Thank you, Mr. Chairman. Dr. Yeakel, thank you again. Mike Went speaks very highly of you, so if he and Jim Knight speak that highly of you, you've earned my trust. So I got to ask you a question here. Yeah, I'm baiting you. That's good. So from my understanding, due to earlier testimony, I understand if you were here for it, that the hospitals aren't being, this is a money question, which nobody wants to talk about, but the hospitals maybe not being compensated for issuing these services. They mentioned that general care physicians or general practitioners would be charging for those visits or those shots, to their understanding. If the hospitals are not charging or getting paid, and the general practitioners are maybe getting paid or billing insurance or whatever it might be, is that going to create a problem with the push for people to go to the hospital settings, or the pull from general practitioners to come to us and create this animosity or this pull back and forth? And if you have been around long enough to understand that could possibly happen. So how are we going to prevent that? How do we, or is that going to be an issue with the general practitioners, and has that been discussed?
Representative Wooten, that's a really good question. And again, being primarily hospital-based in my practice, I would be happy to get someone in touch with you to try to address the economics of how vaccines would be treated in a hospital or a non-hospital physician practice. But it's a very good question.
And being an old football coach, we call that recruiting. So I wouldn't want that. I wouldn't want that to be the case in this scenario. Thank you, Dr. Yeakel.
Yeah, I understand.
Other questions or comments? Other questions or Mr. Johnson? Yes, sir.
Thank you, Mr. Chairman. Just wanted to, and that's a very good question that you raised, Representative West. That's kind of what I was earlier getting to and leading down to with Dr. Bell, with the long-term effects, if there are any of this vaccine and some of the side effects. But with the younger population, are there any known long-term effects that have been discussed by the medical profession with this vaccine?
Again, at this point, the vaccine, my understanding, and I'm reciting what you could find on Google or DuckDuckGo, but anyway, it's a new vaccine. Initial safety and efficacy trials have, to this point, as new as they are, have not shown any significant side effects or bad effects. We're just, we're being told we're going to have to wait for the long term. Now, does your question go into the realm of when do we start to vaccinate patient populations less than 18 years of age. Did I understand that right?
I'm sorry, I didn't hear that last part. 18 years of age, what about it?
Are you asking when the plans are to begin vaccinating people under 18 years of age?
No, just the younger population, whatever that may be, 30 and below.
Oh, okay. Well, again, you know, I don't have anything else to add to the safety or efficacy part of what I've already mentioned relative to
Gotcha.
that.
Thank you.
Other questions or comments? Doctor, thank you very much. We appreciate you being here this afternoon. We appreciate you all's both desire and willingness to be a part of helping get as many South Carolinians vaccinated as possible. And we appreciate you sharing some very good points with us that we need to make sure that we have highlighted, and we will do so with DHEC and our request for information to them.